Hi everyone, and thanks for joining us today for our webinar, StateTribal Considerations and Strategies for Consultation and Collaboration, which was developed and is presented in collaboration with the National Center on Tribal Early Childhood Development, the National Center on Subsidy Innovation and Accountability, the State Capacity Building Center, and the Office of Child Care, which includes the central office and regional offices. I am Sue Foley, State Systems Specialist for Region 1 with the State Capacity Building Center, and I'm so pleased to be joined today by Willow Abrahamson from the National Center on Tribal Early Childhood Development. Willow is the American Indian Alaska Native Training and Technical Assistance Specialist for Office of Child Care Regions 7 and 8. We're also pleased to have Myra Rodriguez from the National Center on Subsidy, Innovation and Accountability, and we'll introduce our esteemed regional presenters later in the webinar. Thanks again for sharing your information in the chat pod, and we're hoping you continue to use this to post questions, maybe share some ideas and strategies throughout the webinar. Barbara Wall, the Technical Assistance Coordinator for the State Capacity Building Center, is going to help us facilitate the chat pod today. And you should also be able to see a file box or a pod with resources that you can download and save for your review later. So right now we're going to take a look at our agenda for the webinar today. We want to thank the Office of Child Care for their support of state and tribal coordination and supporting this webinar. In a minute, you'll hear from Dr. Ellen Wheatley as she welcomes you and opens us up with some remarks for our webinar today. We're going to review requirements for states to consult and collaborate with tribes and look at requirements and considerations for American Indian, Alaska Native grantees. We are so excited that we're going to hear some promising strategies that have worked in Office of Child Care Regions 2, 5, 6, and 10. And you all will have the opportunity to ask questions and to share some conversation with our presenters. We're going to wrap up today with a preview of an upcoming opportunity and some closing thoughts. And now I'm really pleased and honored to invite Dr. Ellen Wheatley, Deputy Director for the Office of Child Care, to welcome you today.
Thank you so much for that lovely introduction. Welcome everybody. It is a great pleasure for the Office of Child Care to be with you today on this national webinar on StateTribal Coordination. So considerations and strategies for consultation and collaboration will be shared today, and we welcome everyone who joined us. We give special welcome to our CCDF grantees. We thank you for your ongoing work for children and families across the nation. As many of you know, the CCDF program requirements dictate that state and American Indian Alaskan Native CCDF administrators consult and coordinate with each other on the development of the state CCDF plans. Across the country, both state and the American Indian Alaska Native administrators have requested TA to help them meet this requirement. This webinar will provide CCDF administrators an opportunity to learn from their peers and OCC about successful consultation and collaboration strategies. In the spirit of government-to-government relationships and partnerships, we've brought together the State Capacity Building Center, National Center on Tribal Early Childhood Development, and the National Center on Subsidy Innovation and Accountability to help facilitate this open forum discussion. And with that, we welcome you to join us today in this conversation about how states and tribes can work together for CCDF children and families across the nation. Thank you.
Thank you so much, Dr. Ellen Wheatley, for that wonderful warm welcome to everybody here on this call. So to get us started, here is the big picture of CCDF and state tribal coordination, consultation, and collaboration in this map, which includes all 10 regions as you see. All of the states indicated in the green are those who have an American Indian or Alaska Native tribal community within their borders. So it's important to know that even if a tribal agency is not within your state borders, its boundaries can cross numerous state borders. One example might be Navajo, which lies within 4 states, which are Arizona, New Mexico, Colorado, and Utah. So within the green, you will see that there are approximately 260 American Indian and Alaska Native CCDF grantees who are actually part of over 573 tribes that are federally recognized by the United States. But please note really quick that you'll see Alaska right there in the green, and you'll see Hawaii on the map on the bottom left as well. Alaska has numerous tribal nations in there, and Hawaii has Hawaiian Native culture and kind of embedded within that state. So they have a really unique relationship. So you see the makeup of American Indian and Alaska Native grantees is important for you to understand so that when you do coordinate around services, you can have an understanding that there's many differences and there's numerous ones and they might be crossing different boundaries or coordinating with different areas. But please also note that within those tribal organizations, the CCDF grantees that you might be consulting or coordinating or collaborating with, please note that they have 3-tiered allocation system, which is based on 3 allocation size categories, which are small, medium, and large, which have a variance in requirements that they have to meet in the CCDF final rule. So I just wanted to paint that picture for you right now. And I also wanted to let you know that as we begin discussing these requirements, let's clear up something about the interchangeable use of American Indian and Alaska Native or tribal. You see, American Indian during this webinar stands for an AIAN, sorry people on the call, right in the middle. AIAN stands for American Indian, and then on the other side of the slash is Alaska Native. So during this call, just know that when we are referring to that, we are referring to those tribal CCDF grantees that you might be coordinating with. And then we also want to respect that some American Indian and Alaska Native grantees might call themselves by nation or by band. Maybe they're a rancheria or a pueblo, or maybe you'll be coordinating with a village, a confederacy, or a corporation. So I just wanted to go ahead and clear that up for everybody in the call. But I'm going to go ahead and pass it on to Sue so she can get us started on a poll. Everybody get ready to flex your fingers. Go ahead, Sue.
Thanks so much, Willow, and thank you for setting the context for us there. I think that's really important as we go through our webinar today. We're going to try out a warm-up activity with a poll right now. We're going to ask you to think about a picture of dancing. Picture that in your mind and choose which of these mental images you think would best represent the current coordination of CCDF state and AIAN program service delivery in your state. And so it's great to see folks jumping right in here and participating in the poll. As we see these results coming in, we are really interested to see where you're at, but also hoping that those of you who may be currently dancing to your own music, and believe me, you're not alone, we hope that you're going to find some promising practices today as we listen to regional strategies and we listen to our folks from the National Center on Subsidy, Innovation, and Accountability. And we hope that you'll get some nice takeaways of promising practices. For those of you that are learning that new dance together, maybe you'll be able to share some of the successes that you're experiencing. And if you've mastered the dance and you're ready to perform, please feel free to share some of those great successful strategies with us. So, for participating in this poll. And next we're going to take a look at some of the language in the final rule and also in the CCDF plan draft preprint. So you can see on your slide some of the actual language that depicts the responsibilities for states, for CCDF lead agencies and states. The CCDF state administrator's role in developing the CCDF plan may include coordination with individuals responsible for the child care program components in order to identify who will prepare required information. The 2016 CCDF final rule added new requirements that states are, of course, required to collaborate and coordinate in a timely manner with Indian tribes or tribal organizations in the development of the plan. And this is at the option of the tribe or tribal organization. The Office of Child Care published a draft of the 2019-2021 Child Care and Development Fund Plan preprint for states and territories in December of 2017. And the current language in the preprint for states and territories defines consultation in this way as you see it here. And it really is meant to intentionally involve meeting with or otherwise obtaining input. And so we really want that to be active engagement. Now Willow's going to help us understand some important elements of consultation. Willow?
Thank you, Sue. So I just want to let you know that consultation really supports a tribe's government-to-government relationship that they have within the United States government. You see, embodied in the Constitution, states are acknowledged, tribes are acknowledged with a unique identity and relationship with the U.S. government. And tribes have tribal sovereignty, which is the ability to govern themselves and their internal affairs and their own citizens. So I just wanted to make that clear, and as you consult, you will find numerous opportunities to see similarities and differences in your CCDF requirements, and you'll learn new different things from one another. And it's an opportunity to open some dialogue and room from one another. So I just wanted to let everybody know that part about coordination, consultation with AIAN, CCDF, and state entities. So the CCDF requirements that impact both states and American Indian and Alaska Native CCDF grantees is illustrated right there. If you see, you might call it tan, I kind of call it gold. You'll see it's a two-way street. Coordination between states and tribal organizations. You'll find within your plan opportunities and requirements where you will be leveraging those existing child care systems that might help you increase your quality and supply. It might help you even with your parents make those informed parent-consumer choices, things like that. So what I wanted to make a point in there is consultation means American Indian and Alaska Native CCDF side that tribes will have the option to consult with states before the CCDF plan is developed and coordinate after the state CCDF plan is implemented with tribes in a timely manner in the development of the CCDF plan and ensure the required training and professional development systems are accessible to AIAN CCDF child care providers. and that these offerings are appropriate for American Indian and Alaska Native children. So that would be like ensuring training is culturally responsive and appropriate for those children in CLARE, and that providers are trained on how to handle like differences that they might run into, and describe in the state plan how the state coordinates services with American Indian and Alaska Native early childhood services. But we're going to hear more about this as we talk in this conversation today. So I would like to go ahead and let you guys know that you will all have the opportunity to discuss more and more within our webinar. And so I'm going to ask Barbara, have we had any input or questions that have come through that we might want some of our attendees to answer to?
Hi everyone, this is Barbara Wall with the State System Specialist Network. Very pleased to be on the call with you today. Willow and Sue, we do not have any questions at this point, but we have had lots of comments in the chat with folks telling us which tribe they're representing today or which state they're representing. We also have regional office staff and representatives from some of the national technical assistance centers. So for those of you that have been chatting, that's the process, one of the processes that is the easiest for you to do if you think of a question. I am going to be watching for those questions, and we'll interrupt the speakers at different points and get the answers to those. You also can, as we said earlier, remove yourself from mute by pressing *6 if you have a question. There will be some points during the presentation where we ask for questions. So, Willow, I will turn it back to you.
Thank you so much for that, Barbara. Much appreciated. So I would like to go ahead and switch to a poll. And in this poll, I would like you to please choose the response that best applies to you. And it's only going to be up for a little while. So go ahead and take that opportunity. So as you'll see from the left, in our state, trainings are available and accessible to all child care provider types. Go ahead and choose an option there. In the middle, you will see in our state, AI, AN, and state CCDF lead agencies talk together. Go ahead and choose one of those options. And then on the right, number 3, you will see in our state, AI, AN, and CCDF lead agencies have worked together to develop culturally responsive training. Now, I think we'll just wait about 2 more seconds, and I'll go ahead and pass it on to Sue to kind of summarize and go on to our next portion of this discussion.
Thanks again, Willow. It looks like we had a variety of responses there. It looks like we had more responding that the trainings, they know that the trainings are available and accessible, and maybe not so sure about lead agencies and state agencies working together to develop culturally responsive training. So let's just take a look and review some of the requirements here as we've had a chance to think about what's happening in states. It is important to note that states are required to provide access to training and professional development systems for AI/AN providers and ensuring that they're culturally responsive, that there's an accessible career pathway or system, and that the training and PD is inclusive for providers. We also want to consider opportunities for American Indian and Alaska Native grantees. They can coordinate with states to ensure training and professional development is available. Health training is culturally responsive, so that's an opportunity for consultation there. They can join or collaborate on state career pathway systems that support child development credentials or degrees, and can work with the state to coordinate training to be more accessible or inclusive of the AI and AN providers. Once again, looking at language from the final rule, we want to make sure that we're aware that there is a requirement to coordinate to the maximum extent feasible. And again, you see the importance of collaborating around training and professional development opportunities. Willow, can you help us review the final rule for American Indian and Alaska Native grantees and some considerations for coordination?
Definitely, I will go through. So, CCDF requirements for American Indian and Alaska Native grantees, well, they shall coordinate their programs to the extent practicable and to the maximum extent feasible with the lead agency in the states or states in which them as a grantee will carry out their CCDF programs. And I just want to remind all of you that AIAN grantees, they will describe how they will coordinate with the state CCDF programs and with other federal, state, and local programs serving children within their plans. So tribes, you should be consulting with a number of local and state entities when developing. And just remember, you'll want to demonstrate different aspects of that coordination, such as how you're coordinating with other programs that might benefit the children that you serve, such as American Indian and Alaska Native children, infants and toddlers, children with disabilities, children experiencing homelessness, and children in foster care. So think about it when you're coordinating in the context of also that you're expanding accessibility and continuity of care, as well as full-day services. So we'll talk more about how coordination works and how we can go ahead and become partners in implementing services. And as you see on the slide here, there are numerous considerations that American Indian and Alaska Native grantees will be considering as they're developing their plan. For example, one on this page might be public education. And maybe look at that in the context of coordinating with McKinney-Vento services, or one example on coordination on this slide right here includes emergency management and response. I mean, there's numerous opportunities for our grantees to coordinate with one another so that we can carry out quality services, so that we can improve equal access, so that we could build quality in supply, ensure health and safety. I mean, there are so many ways we can coordinate to ensure comprehensive services. But to illustrate a little bit more of the context here, I just wanted to go ahead and let you know that even outside of your plan, there's many wonderful opportunities outside of it where you can coordinate around things like licensing. You can come together and you could talk about background checks. So I just wanted to put that out there, and we'll actually hear about it more when our wonderful presenters today share their accounts and their strategies about some of the numerous options and what the spectrum of coordination might look like. So to get us started, I would like to go ahead and invite Myra Rodriguez from the National Center on Subsidy, Innovation, and Accountability here to talk about how states and tribes can coordinate together around this area. So go ahead, Myra.
Thank you, Willow. And good afternoon, everyone. This is Myra Rodriguez from the Subsidy Center, and I'm very pleased to join you today. Thank you, Willow, again for walking us through the CCDF requirements for American Indian and Alaska Native grantees. So with those requirements in mind, and by knowing that the purposes and goals of the federal CCDF funding are the same for states, territories, and tribes, We will now move on to further commonality and talk about what is known as dual eligibility. So in the final CCDF rule, American Indian and Alaska Native children retain the ability to be dually eligible to receive services. So this means that parents of eligible AIAN children might apply for and receive child care assistance from either the tribe or the state. So let's remember that eligibility for a tribal program does not affect eligibility for a state program. So children can be dually eligible for services. And in order to receive child care services from either the tribe or the state, the child must meet the eligibility criteria for that program. And except for a few rare scenarios, all AIAN children are eligible to receive services from a state CCDF program or a tribal CCDF program. Okay, so let's talk about aligning eligibility. One way to align eligibility is through program income limits. So many tribes have chosen to look at their eligibility criteria and set their eligibility thresholds at the highest possible level. Or some of them have exempt income that is not exempted by the state CCDF system. So this means that the children from families with the lowest income are served by the state program, and children from middle-income families are served by the tribal CCDF system. So this pretty much helps maximize the number of children that can be served within tribal communities. Something else to consider here is that states cannot have a blanket policy of refusing to provide child care services to AIAN children. Another area that states and tribes could explore is the eligibility period. As part of the reauthorization, tribes with medium and large CCDF allocations are required to establish a minimum eligibility period of 12 months. So CCDF tribal lead agencies can further support continuity of care and provide greater stability by aligning the beginning and the ending dates of the eligibility period with Head Start and early Head Start programs. The area of vulnerable populations is also an area worth exploring. Tribes have the flexibility to expand the protective services term to include populations that are vulnerable, such as families that are experiencing homelessness or children in foster care, which both of those categories are automatically eligible for Head Start and early Head Start programs, regardless of the family's income. Also, similar to states and Head Start programs, tribes must also use the McKinney-Vento definition of child experiencing homelessness. And if we could advance to the next slide, please. Thank you. Other than aligning eligibility, lead agencies would also need to think about how the referral system will function. So we know that one of the main goals is to make the eligibility process more family-friendly. And at the minimum, lead agencies are expected to collect sufficient information during the CCDF intake process to make those necessary referrals. So thinking specifically of child care resource and referral systems, tribes have the ability to spend quality funds on the CCR in our system. So states and tribes can partner to make the resource and referral system stronger within their states. That's a good opportunity. Another consideration here is how will this dual eligibility system function? So in order to maximize the effectiveness of this dual eligibility provision, states and tribes are encouraged to have memorandums of agreement or in understanding with each other to share information and ensure that the application process for tribal families is streamlined. And, before handing off to the next presenter, I also wanted to share that from a subsidy perspective, tribal and state CCDF administrators are learning that there are far more benefits to collaboration than simply meeting the federal requirements of consulting with each other around the development of the CCDF plan. The benefits to the children and families being served is by far the greatest rationale of working together. Also, with the purpose of maximizing resources, it is important to have open lines of communication and, if possible, regularly schedule coordination meetings between states and tribal CCDF programs to help reduce the risk of families receiving services from both programs for the same childcare slot. So throughout the rest of this webinar, you will hear specific examples of how states and tribes have been able to develop those strong collaboration relationships. And with that being all from the subsidy side, I will give the floor back to Sue.
Thank you so much, Myra. This was really excellent information, and I'm so glad you talked about dual eligibility. I do want to point out that in the download file pod, there is a resource from your center, the National Center on Subsidy Innovation and Accountability, that does have a section in there that focuses on this, so we thought that might be a useful resource for folks. Barbara, I'm going to pause for a minute here to see if there are any questions from Myra around anything related to subsidy and dual eligibility that she just spoke about, or if there are other questions in the chat pod that we could take a minute to address. So Barbara, if you're ready, you can go ahead and unmute yourself and take a look at the chat pod.
Okay. Can you hear me now, Sue?
Yes, thank you.
Much better. Sorry about that. There are a couple of questions around the designation of whether we're talking about all tribes or federally recognized tribes or tribes that are CCDF funded receiving or CCDF grantees. So for the purposes of this webinar, we are talking about CCDF grantees, and we use the term CCDF lead agencies with states, and then more the grantee term with the tribal organizations and the administrator of each, either or each. The tribal or the state would be called the CCDF administrator. We also have a very brave, newer state administrator, TJ Bennett, who was willing to pose a question, and she is the new state administrator, co-state administrator in Maryland. So the question primarily, so that everyone hears this, is when the CCDF state plan says we should partner with tribal organizations, must they be federally recognized tribes, or do state recognized tribes count? And for purposes of our webinar today, we are talking about federally recognized tribes. And in the chat box, you'll see that Brian Richmond, who is with the Office of Child Care and focuses on the tribal functions of CCDF, will be following up with you specifically, TJ, but for everyone else, generally we are talking about federally recognized tribes.
Hi, Barbara, and everyone else on the call. This is Jenny Gipp. I'm in the Office of Child Care. I'm actually in the office with taking the webinar here with Ellen Wheatley, who had to step out, and with Brian Richmond. And for those of you, most of you who I don't know, I'm the Technical Assistance Director in the Office of Child Care. And I worked on tribal issues in our office for many, many years before I took this job. My husband is American Indian, and my daughter is also enrolled in his tribe. They're both Hunkpapa Lakota from Standing Rock Sioux. Just this way of introducing myself and trying to give myself a little bit of credibility because I know these issues as our regional office staff do and others here. But I wanted to say that, so TJ, I know that Maryland has a couple of federally recognized, state recognized tribes. I've done a little bit of research there before the call because it was interesting to see there are some states on this who at least signed up for this webinar that do not have CCDF grantees, tribal CCDF grantees, or federally recognized tribes. And you're very brave to just put it out there. Good for you. But in regard to your specific question, CCDF funds are for federally recognized tribes. So that is for your consultation, and your coordination. It has to be with federally recognized tribes. The more you reach out to any member or citizen of your state, the better in coordination of services and program activities. But CCDF is for federally recognized tribes. Thank you.
Thanks so much, Ginny. That clarification was really, really helpful. So thank you, Myra. Thank you, Barbara. Thanks for everyone who's sharing in the chat pod. Thank you, TJ. And we'll go ahead and move on now. And we're going to take a look at this map of the 10 Office of Child Care regions. So thinking back to that first map that we looked at, showing those federally recognized tribes, the states with federally recognized tribes, and then now thinking about where the 10 offices are located, the 10 regions are located, we are so honored and thrilled today to be able to have 4 of these Office of Child Care regions represented. And they're going to be talking about some regional strategies that have been successful in supporting state and tribal coordination. So Willow and I are really pleased and excited to introduce our regional presenters from Region 2, Magda Marcarno, Regional Program Manager, and Audrey Newhouse, Regional Program Specialist. And they're going to discuss with you their consultation process and strategies that have been successful there. So Magda and Audrey, I'll turn it over to you. And if you're muted, you need to star 6 to unmute yourself.
Can you hear me now?
I can hear you now. This is great. Thank you.
Thank you. This is Magda Marcano. I am the Regional Program Manager for the Office of Child Care here in Region 2. I have federally recognized tribes in New York State. We also have under our purview New Jersey, Puerto Rico, and the Virgin Islands. And the 3 tribes that participate in CCDF are the Akwesasne, or the St. Regis Mohawk Indian Nation, the Seneca Nation of Indians, and the Shinnecock Indian tribe. Audrey Newhouse is the program specialist who has expertise in Indian tribe relationships. She handles all of the tribal relationships here in the region, and she will give us a little background at this point of how we've reached the strategy or the consultation stage that we're about to begin in Region 2. Audrey? Star 6.
Magda, it looks like Audrey is perhaps having some trouble unmuting. Would you like to go ahead and share a little bit more?
Of course I will.
So,
hello? Okay, there you are.
You hear me now?
I just introduced you. I hope you're not having technical difficulties.
No, I've been hearing you. Yep. I just had to hit *6 twice.
Oh, okay. So go ahead and provide everyone with a background on...
Okay. I apologize for that, everyone. Hello, everyone. I'm Audrey Newhouse. As Magda said, I am the other half of Region 2, the Regional Program Specialist, and I work mainly with the tribes in Region 2. So we have 3 CCDF grantees, the St. Regis Mohawk, which are to the north, which shares a border with Canada, the Seneca Nation to the west, which almost goes out to Pennsylvania, and the Shinnecock Nation to the east, which is at our easternmost point, which is on the Long Island Sound. So we have pretty wide representation of the state of New York. Together they serve about 11,000 children in tribally operated centers, family child care, certificates, and an early Head Start child care partnership with a local Head Start grantee. And an interesting thing about Region 2 is that we have 3 tribes, and all of them have center-based programs. So that makes them a little different. So we have been working on this for quite a while, I would say. So it's taken a long time. So here we have 2 of our tribes, their centers are licensed by the state of New York. So they are New York State licensed child care centers. One of our tribes is self-licensed, so they are not licensed by the state of New York. We also have child care family homes that are licensed by the tribe. So that paints a little bit of a picture of how we work. We also have now one tribe that just got approved for 102-477 consolidation. So that's going to be a little bit new for me and for this region. New York State is a large county administrator state supervised CCDF system. So the counties have flexibility on how they implement the CCDF system, and the state supervises that. As a result, each tribe must reach out to both New York State and to the counties that administer the CCDF, the state CCDF programs, which just adds another layer of interest into our dancing here. So that has worked pretty well so far because the tribes have had very strong relationships with their county-based providers and state representatives. So I think that has been a strength that we have had. So we are trying to figure out ways that we can help them and continue to support each other. And with the new regulations, it has sort of brought the coordination and the consultation up a notch for all of us. So about 2 years ago, we noticed that there was very little regular communication between New York State and our 3 tribes. And as a result, we decided to start having first monthly check-in calls with each one of the tribes on a regular basis. In the beginning, these were very short calls. We had a lot of calls where we would have to send text or call, or the 800 numbers didn't work, to get people on the call and into a routine of we are having a call. So even that was a little bit difficult for us.
But now we've gotten to the point where we are having 1-hour calls regularly, and sometimes we go over time because it's just not enough for all of us to talk about what we need to say. So that has been a really wonderful thing for us. And now, and in the last 2 years, we've started to have New York State join us in quarterly consultations, quarterly relationship building meetings. So we look at this from a relationship building situation, and it's a slow process. So I can tell you that we have had some missteps in our dance, to quote Daniel Stern, but we are sort of moving to the same music. New York State always had a consultation process with its tribes, and what was happening in the past was that the CCDF plan, the state's plan, was presented for comments at a tribal consultation meeting. And that meeting was part of the requirements for the ICWA, or the Indian Child Welfare Act regulations. So what would end up happening would be that tribal leadership would attend, but they were rarely the child care program directors or the people with direct relationship with the child development program. So what we did was we did send 1 year the child care development folks straight up to the consultation meetings, and they were very dissatisfied because they felt that they had maybe 10, 15 minutes at the end of a very long meeting that was centered around child welfare issues to discuss the state plan, and they didn't feel that that was sufficient. So they are now trying very hard to do a more proactive approach. So what New York State has done was, first, I think our first step was the state administrator went up to a meeting with the tribes at one of the reservations, and being on tribal land, I think, began to change how the process was understood or going, and I think it opened up a lot of doors. And from there, we have gone to quarterly meetings, as I said, with the states. The state of New York has appointed or identified a contact person or point of contact within the lead agency that is to coordinate the dialogues with the tribes, and we're slowly working towards more regularity and a more robust agenda. So the process has taken about 3 or 4 years. We've been thwarted by many leadership changes, which seems to occur every time there are elections. So we need to forge new relationships each time with myself, with the state, and amongst the various tribal administrators. But the stability has been much better of late, and I said, and New York State has been very active, very proactive in reaching out to the tribes and trying to craft some way that we can start working together. So this has been a great step. If I were to say that there were lessons to be learned, I would say that relationship building takes time. We need to respect where each tribe is. They're all different, and they have different histories. They have different histories amongst themselves. They have different histories with the state.
and they do play into how trust is developed. The state and counties are also coming from different points of view, and unfortunately, you know, you have limited resources, and sharing resources sometimes gets a little difficult. But we're working through that. I think the appointing a point person from the lead agency is a great idea. So thank you, New York. And I think we need to look for more opportunities to have in-person meeting. I think that is a great vehicle. I know the webinars are wonderful, and I know phone calls are wonderful, but being with people and getting to know their environment, whether it's their offices at the state level or tribal council, it changes your perspective, and you get a different feel for people. And I think that it makes the work go faster in terms of building relationships. And the last thing I would tell people is to allow for the ebbs and flows in momentum in terms of this process, and be really patient, because I can tell you it has taken 3, maybe 4 years, if not more, of working together. So, Magda, do you have any other thoughts to add?
Thank you, Audrey. That was great.
Well, that was fantastic. Thank you so much, Magda and Audrey. I really loved your point that you made there about having a point person and those in-person meetings. And it sounds like you really took a lot of time to build those relationships and to develop that trust. So I think that's really helpful in us thinking about this consultation process. We probably have time for maybe one question. Barbara, I'm going to ask if you've seen anything in comments or chat, or if anyone needs to unmute to ask a question.
We have not seen anything in chat specific to this presentation, or no new questions. So if you have time, we can ask anyone. We'll pause and ask if anyone wants to chat.
Okay. I'll be busy. Bye.
I think, Sue, in absence of hearing anyone else, that maybe we should move on to Region 5.
Sounds great. So thanks again from Region 2, and we're going to take a virtual travel now over to Region 5. I don't believe Gina was able to join us today, but we're very lucky to have Maria Pestallardo with us. She's the program specialist in Region 5, and she's going to share a little bit about some successful strategies that have been working there. So Maria, are you all set?
Yeah, can you hear me?
Yes, that's great. Thanks so much for stepping in here.
Sure. Good afternoon, everybody. So we are going to share with you the strategies we use in Region 5 with our tribes and states to help them implement collaboration and coordination strategies. So in Region 5, there are 6 states and 34 federally recognized tribes. 30 tribes received CCDF funding, and they are in the states of Wisconsin, Minnesota, Michigan, and Indiana. So one of the tribes, the Pokagon Band of Potawatomi Indians, is in between the states of Indiana and Michigan, and it works with both states. So we are lucky that in our region, 2 of our states, Minnesota and Wisconsin, have intertribal groups for CCDF administrators. These groups are MenTRACT, or the Minnesota Tribal Resources for Early Childhood Care, and WITCA, the Wisconsin InnerTribal Childcare Association. And both groups are supported by the state lead agency. So that provides an avenue for tribal programs and state lead agencies to coordinate and collaborate. So what we do, we support both groups by going to their meetings, and we typically present about topics that affect both the tribal and the state program, because of course it's mainly for tribal administrators, but the state lead agency typically has one or more state representatives. So we have presented about reauthorization implementation, criminal checks, and so on. And it helps because we are able to address this topic to both the tribes and the state. Also, we have provided peer-to-peer support to Michigan. Michigan is building the relationship with tribal programs. They just had their second collaboration meeting after reauthorization last week. And we have provided peer-to-peer support and calls with other states that work with tribes and with other intertribal programs, not only in our region, but also with Oklahoma. So we are hoping that these peer-to-peer connections help them identify replicable strategies based on their needs and resources. What else? We have organized calls between the state and the tribes as per tribal request due to the new requirements around collaboration and coordination. They wanted to have a call between each state lead agency and the tribes in that state. So we did that to answer questions that they may have. We have shared MOUs with our states in case they want to implement MOUs with their tribes, because some of these tribes receive state CCDF funding, and they are trying to figure out how they're going to work together when it comes to meeting state CCDF requirements, not only federal CCDF requirements. And then we have also worked with our states, stressing the need to work with tribal programs before the final draft of the plan is created. So I think those are the main strategies we have used. If anybody has any questions, please let me know. But other than that, I will pass it on.
Thank you so much, Maria. I think that was really interesting to hear about the intertribal associations as an avenue for coordination. That was great. And then your strategies for peer-to-peer support seem like they're really helping to identify what the needs are and to be supportive. Is there anything else that you can share about those MOUs? I'm wondering if you can talk a little bit about maybe what the process was for developing those, whether you've managed to develop a template for folks to use.
So I did not. So I work with the tribal center, with the old tribal center. This is years ago, and they had samples from other states, and they shared those samples with us and with our with our states that were interested in looking at how to develop MOUs with tribes. So I do have the samples, of course, but I did not develop it. It was just through our tribal center that shared those samples with us and with our state lead agencies. We have one state lead agency that is developing an MOU with tribes at this point. They have already released the first draft, and they have shared it with the tribes during the last intertribal meeting that was last week. So we have that MOU in the region for Minnesota. I am not sure if Michigan and Wisconsin are developing MOUs at this point.
Well, thank you so much. That's really helpful. And Barbara, I do see that there may be a question in the chat for Maria.
Right, Maria. Abby Cohen, who is in Region 10, the Regional Program Manager, has asked, Do the InnerTribal Associations in Minnesota and Wisconsin have their own staff?
That's
Is that,
yeah.
go ahead.
Sorry.
Go ahead.
Okay, so so I'm not an expert about WITCA, and I am so sorry. I'm just filling it out for Gina, but I can tell you that Mentrec does have its own staff. They have like a program coordinator, if so, and then they have other staff that works in specific areas of the program, like workforce development and so on. They are supported by the lead agency mainly. They used to also receive funding from Race to the Top, and I believe another funding source I don't remember at this point. But they were working with something like $260,000. That was the annual budget, something like that,
Okay.
give or take. And I am guessing that WITCA is the same. If there is someone from WITCA, they may be able to present. I do know that with WITCA, they started WITCA many, many years ago, and the person that was coordinating WITCA was a tribal person. I think that throughout the years, for one reason or another, the state lead agency ended up, I don't know if it's coordinating the group or having a say about how to coordinate it. And I think the last year they went back to pure tribal leadership, but I don't know exactly how that works. I do know that the person that coordinates the WITCA also gets paid for it. So it's not that it's a tribal administrator that is volunteering to do it. I don't remember exactly. I think the previous person was in a CCR&R.
Okay.
Yeah.
Well, thank you. Yeah, thank you very much for that. And I think, Abby, Susan Warbaugh is also typing when it pops up in the chat room. There may be some additional information from Region 5.
Yeah,
so,
and I'm happy to
you.
share information about Mentrec and WITCA after the webinar. If anybody has specific questions, I'm happy to get back to you.
Perfect. Thank you so much, Maria.
Sure.
Sue?
Yes, and Maria, this is Sue, and I just want to thank you again for stepping up. You didn't know you were going to do that today when you joined our webinar.
That's okay.
We really do appreciate it, and you shouldn't apologize. Helpful information. And folks, we will talk a little bit later about our next opportunity coming up, but there will be an opportunity to take a deeper dive and get more information after this webinar, so that's something to look forward to. So let's move now from Region 5 to Region 6. We're going to be hearing from Lisa Blackmon, Child Care Program Specialist in Region 6, and she's going to share some different strategies with us today. So Lisa, if you're all set, we're really excited to hear from you, and thank you again for doing this.
Hi, everyone. Can you hear me?
Yes, we can hear you fine.
Great. And thanks for the opportunity for us to share some information regarding some of our innovative strategies and considerations for consultation and collaboration within Region 6. Region 6 is comprised of the 5 states, including Arkansas, Texas, Louisiana, Oklahoma, and New Mexico. Within our region, we have 56 AIAN CCDF grantees, representing 63 tribes and pueblos within 4 of the 5 states. And the breakdown of that is we have 2 in Louisiana, 15 in New Mexico, 3 in Texas, and 36 in Oklahoma. What I would like to share today are some examples of state tribal collaboration from Oklahoma, and then also share how with the peer-to-peer networking and information sharing, as Maria had mentioned within Region 5, how that has helped to encourage and support and promote partnerships even within other regions and throughout other states. Within our region, we have examples of strategies focusing on the child care subsidies and dual enrollment, development of early learning guidelines, child care resource referral and delivery services, child care licensing, and training and professional development. And in the interest of time, I would like to just kind of focus, as I mentioned, on a couple of unique examples from Oklahoma, and then to share how that has supported other states. Within Oklahoma, we have a CCDF designated service area, and within CCDF plans, tribes must define their service area. And many of those include communities located both on or near reservations. However, the majority of tribes in Oklahoma don't live on reservations and are encouraged to work together to ensure that their service areas are not overlapping. States and tribes recognize that by working together to help to avoid duplication and then also to maximize the limited resources and services. They also work very closely and collaboratively together to share and learn about each other's best practices in areas that were previously defined in the beginning of the webinar, including policy development, training, licensing, and importantly, developing culturally sensitive and relevant services. Within Oklahoma, there is a long-standing partnership between the state CCDF agency as well as the tribal CCDF programs in Oklahoma. It's referred to as the Oklahoma Tribal Child Care Association. And this was formed in the early 90s during the earlier phases of CCDF for tribal programs. There was a tribe in Oklahoma that approached the state of Oklahoma regarding available resources, partnerships, and over time that has, as I mentioned, developed into a very long-term, long-standing partnership within the state. The Oklahoma Tribal Child Care Association is a representative agency for AIAN organizations serving tribal CCDF grantees that represent the tribal communities across Oklahoma. The state of Oklahoma is very engaged in the, I'll just refer to it as OTCCA. In the earlier phases and stages of this, they typically had only one representative from the state that attended their meetings. They have quarterly meetings where they share information, policy updates, best practices, highlighting program issues related to funding, enrollment, training, and then also ways to strengthen that partnership. And so the state, as well as the tribes, really recognize the value of attending these quarterly meetings. And now the state leadership team, the state CCDF leadership team, focusing and representing areas of professional development, QRIS, licensing, subsidy, as well as other members attend. And then they also invite representatives from the State Early Childhood Advisory Council, members from the CCR&R, and other state early childhood professional development agencies. And this is an excellent opportunity to, again, share and promote updates, and then also activities to strengthen and provide high quality child care. Another unique aspect of a partnership and collaboration within Oklahoma is related to the Child Care Resource and Referral Delivery Service, or Referral Delivery System. Oklahoma directly contracts with 2 tribes to provide comprehensive child care resource and referral services. Oklahoma's approach is to fund the 2 tribes to serve as the CCR&R agencies for both Indian and non-Indian families and the providers in the large multi-county areas of the state. And then the state meets regularly with their contracted partners in their regions, and they have the members and serve on different committees and have included the tribal staff to bring different perspectives, functions, and services. Another unique partnership as well as collaboration strategy has been related to child care licensing and monitoring. Oklahoma established a reciprocal licensing agreement with specific tribes that allows the tribes and states to cross-monitor child care programs. And this is done by sharing monitoring reports and conducting joint complaint investigations. So the tribal child care monitoring staff is also included in all state training for licensing and monitoring. And then this allows the state licensing to share the monitoring visits and reports. It helps to reduce the duplication of monitoring activities when facilities are licensed and monitored by the state and tribe and/or tribe. And typically, there are 3 annual monitoring visits conducted in Oklahoma. The state will conduct 2, and the tribal CCDF, Reciprocal Licensing Agency, will conduct 1. And they also work together to coordinate regarding complaints as well as with training. There's also extended opportunities for professional development. There's coordinated efforts related to that. And I just wanted to share how those 2 strategies have helped to support, influence, or encourage that within other states within our region. Louisiana has contacted the state of Oklahoma to share information regarding the reciprocal licensing agreement. The state of Louisiana did model their reciprocal licensing agreement after that of Oklahoma. And we do have 1 tribe in Louisiana that is also part of that process. And so that was something that was very innovative. And as Maria had mentioned earlier from Region 5, as far as for the peer-to-peer networking across states and tribes, that was something that was very effective and continues within the state of Louisiana. Another area as far as for a tribal association, we had an opportunity at one of our regional tribal consultations many years ago to invite the New Mexico State CCDF as well as some of the New Mexico Pueblos that receive CCDF funding to come and actually attend a meeting of the OTCCA. And during that time, information was shared, and they, at this time, have not reconvened the association within New Mexico. However, there has been a reconvening of sharing information monthly related to professional development, health and safety. And then more recently, we have implemented monthly readiness check-in calls with all of our tribes. And we do that in a variety of ways. Sometimes they are very specific to the allocation sizes and related to different topical areas. But at the beginning of this year, we were able to kick it off with a StateTribal Coordination, where we had the state administrator to come and share information, and then also to share how the tribes could be a part of helping with the state CCDF plan development as well. And from there, we have continued with monthly calls, and then if there have been any specific requests from tribes and or states, we're working at the regional office to help to coordinate that. And that is also facilitated and coordinated with our technical assistance partners as well. And it's done through a monthly webinar, which is, it's recorded. So there's a lot of great information sharing. So those are, I think, some of just a brief example of some of our very effective coordination strategies.
Well, Lisa, that was a lot of great information. So thank you so much for sharing that. It really was interesting to hear about the reciprocal licensing agreements and those monthly readiness check-in calls. And it sounds like you've got a lot going on there with those strategies. So we know that when we go forward from this webinar with other opportunities, that we'll have chances to take deeper dives into some of these subjects. And Lisa, folks hopefully can get in touch if they have questions for you, and we may not have time to answer them all today, but we will definitely follow up if folks have questions about any of that. So thank you so much. It was great. We're going to just go ahead right now and go across over to Region 10. And we've got our esteemed presenter here, Paul Noski, Regional Program Manager, and he's going to tell us about what's working well in Region 10. So Paul, thank you so much. And Paul, I don't know if you'll have to do *6 twice. We know somebody else had that challenge earlier, but *6 to unmute yourself. Well, it looks like we're having a little bit of technical difficulty.
I'm on.
Okay, great. Super. Take it away, Paul. Thanks.
Well, good afternoon, everyone. And I'm Paul Noski in the Office of Child Care in the Seattle office. And I wanted to share our story as it relates to coordination and collaboration with all of our CCDF grantees in Region 10. Although I'm the one that's telling the story today, it was really a team effort with Sarah Stafford and Dr. Burchard in our office. And then we've recently lost two staff in the last few months, Gretchen Starr-Brunig and Tim Murphy, who are a large piece of this process as well. And along with our National Center on Tribal Early Childhood Development and all of our CCDF grantees, it was just really a team effort. So Region 10 consists of Alaska, Idaho, Oregon, and Washington, and over 265 federally recognized tribal nations and villages. There are 68 AIN CCF grantees that provide services to the 265 plus tribes and villages. In Alaska, we have 30 grantees. In Oregon, we have 9 grantees. Idaho, we have 3 grantees. And in Washington, we have 26 grantees that represent 29 tribal nations, as I think Julia from our AIN grantee Muckleshoot had put in the chat box. And I wanted to highlight our composition in Region 10 because it impacts how each one of our state CCF grantees coordinates, collaborates, and consults with each of the tribal nations and villages within their states. Our AIN CCF grantee lands are located in urban, rural, and remote areas, which there are both many opportunities, but also challenges in providing high-quality child care. And that our Office of Child Care Region 10 continues to build really strong relationships with all of our grantees in the AIN communities as well as our state CCF programs. These relationships have led to a greater understanding of those opportunities and challenges that our grantees face when implementing, as we all know, the CCDF program that is really complex due to all of the flexibilities. Because of our strong relationships, our grantees know who we are and they feel comfortable in calling us for policy guidance and technical assistance. And I think it's that relationship with our grantees that is really our foundation in our work. So together, and what I mean by together, everybody in our region, we all embarked upon a journey that has resulted in increased collaboration and coordination to create higher quality child care for children and their families and support providers. So at the beginning of 2017, with the addition of 2 new staff, Sarah Stafford and Gretchen Starr-Brunig, we developed a framework for how we wanted to engage our state and AIN CCF grantees in a joint conversation related to the CCDF reauthorization and implementation. So within that framework, our goal was to continue to build the relationships with all of our grantees, but to better understand how our grantees administer their programs, to listen to our grantees' successes and challenges, and understand how we could support the coordination collaboration efforts. But what made these calls and site visits, some of them turned into site visits with our AIN grantees, different than our prior calls, is that, at the tribe's invitation, we invited our state CCDF administrators and our state staff, our tribal liaisons in the states, to be a part of each individual call and to build those relationships one-on-one. And we did this for most of our 68 grantees. And so we had, overall, each call lasted 2 to 3 hours, and sometimes even more than that. And there were part twos of these calls as well, because we got really very deep into conversations and really understanding each other's work. So our initial goal was to travel to each one of the grantees in person or as much as we could, but due to travel restrictions, we conducted calls via Adobe, and oftentimes the state CCDF administrator would go and visit, or the state staff would go and visit the tribal nation and the AIN grantee in person. And we would listen on the call, and we would be a part of those conversations via phone. And, and sometimes we were able to go out and travel, but I have to say that Kelly Walker in Oregon and Selena Ives in Washington State made it out to almost every single grantee, and which was, I think, very beneficial. So as a result, everybody learned a lot from this process from one another. All of our grantees, all of our state CCF grantees listened and really acted upon resolving issues related to subsidy, quality, licensing, background checks, even state pre-K in some cases. Just everything that was brought up on the call, we were able to address or make a plan on how it would be addressed. And then, but after the calls, we really noticed that our AIN grantees were often contacting the state to resolve issues. And so, not that that didn't really happen before, but I think that we really noticed an increase in contact between the AIN grantee and the CCF grantee, the state CCF grantee. And I think that, to me, I think is very much a success story. And so most of the AIN grantees, but I think our biggest impact that we had was at our convening of our AIAN CCF reauthorization implementation meeting that was held in September of 2017 in Seattle. So most of our AIN CCF grantees attended, as well as all 4 state CCF program staff. We structured the meeting to provide an opportunity for AIN and state CCF staff to network and strengthen their relationships from the calls that we've had during that previous year, and had time for states to share on how they were implementing CCDF, and provide some of the greater detail. And then also for states to listen to the AIN grantees with potential implementation issues. I think that was really important. And, we had one of our states that, like everybody attended, but one of our states in Washington, they had multiple staff come and talk about things like background checks and licensing and subsidy. And it was a really, really good meeting when we broke up into the state groups. So the initial calls and site visits really laid the groundwork for our AIN grantees to move forward together. But I wanted to, some of the outcomes this year from the phone call and from the meeting that we had that Idaho now allows the use of cradle boards in their standards for safe sleep practices, and I think that's something that is something that that I think came out of a lot of this coordination and collaboration. Oregon provides state CCF subsidy to providers who are licensed by a tribal nation and allows the tribal nation providers to use the state's background check system. And I think, I love hearing the calls where grantees are calling the state directly with issues, and the state is really on those calls with their peers at the AIN grantees are on the calls with their peers in the state, and we're really working on these issues together. And then Matt Judge in Salina in Washington has had follow-up meetings with tribal nations related to the proposed state health and safety standards. And I think that was a really fantastic meeting where they really were able to walk through each individual standard and share those with the state. And the state is, even though they're meeting those requirements currently for health and safety standards, they're improving their standards, and they're inviting the AIN grantees to participate along the way as they're developing those standards. So in closing, I know I'm talking a little fast, but in closing, I wanted to share some details that I found helpful in the past. One, if you're working with tribal nations, gain an understanding of sovereignty, tribal governance, and other information on each tribal nation or village within your state. Ground yourself and your staff in cultural competence. And Office of Head Start has some really great resources on working with tribal nations. And also consider recruiting a diversified workforce who have experience in working with tribal nations or with tribal nations. And so I think that has really benefited Washington State particularly. And they also have a training available for all state employees. It's called Since Time Immemorial, and it's on the website. And Washington State also has the Indian Policy and Early Learning Committee that meets and talks about child care and early learning policies. And we're invited to those as a regional office, and we participate. We're able to hear and from our grantees within Washington. And it's been very helpful as we move forward as an office. Invest in relationships with your AIN CCF peers. You have a lot more in common with your AIN administrators than you may think. Many of our AIN CCF administrators operate centers, subsidy programs, licensing, but they're also sometimes the TANF administrator, the child welfare administrator, the Head Start director. So there also can be tribal leadership and also elders. And your AIN CCF peers can provide you with some really good advice related to the state policies that support Indigenous early learners. Collaboration, coordination looks very different in each one of our states. So if you can't do it, enlist the help of others. So Marcy Bish in Alaska works with 30 AIN CCF grantees representing 225 tribes and villages. So her staff and contractors coordinate with all of the AIN grantees when going out to the communities to talk about child care licensing and child care assistance program, and that they work with Thread Alaska, which is their resource and referral, to actively recruit AIN CCF grantees to participate on the early learning committees in Alaska. So I think it looks very different depending on the state, and there's and I think that it's the dedication of all of our administrators that make a difference. So, and the one other thing that I will share is that, before you change state policies, let the AIN CCF grantees know as much time as you can provide them. That would be great, because they may have to amend their CCDF plans, because anytime they align their plans with your plans and you make a change, they have to amend their plans. So I think giving them a heads up, I think is very, very helpful. So that's all that I have. I'll turn it back over to Sue.
Yes, thank you so much, Paul. Lots of great information. We just could go on and on, I think, for a couple more hours, but we really appreciate everything that you had to share. And I think what we're going to do now is go to our very last poll and talk about our next opportunity coming up, which will be a community of practice. And so we'd love to get input from folks if you're still with us. Whether you're interested in participating, you can hear more about these excellent strategies. I know Paul has a lot more information to share, as do all our other regions, and we really would love to find out if there's interest, and then also which would be the most ideal time for you to be engaged in a 4-session series for a community of practice. And that would be a deeper dive for you and your peers to come together and share ideas and strategies based on what you decide is the most important interest. If you have time to type in a topic of high priority, please do that. We definitely will also follow up with you again. And as you're doing that, I'm just going to queue up Brian Richmond, who's going to be sharing with us some closing remarks as we finish out our poll here. And so let's go ahead and invite Brian to do that while our folks are still sharing some of their high priority topics.
Thank you, Sue, and thank you to all our presenters today for sharing important information, and for all the grantees that were listening in and participating also via chat and by your attention. We do want to encourage you to sign up for communities of practice. We have the opportunity now to be able to share a lot more information about the successful programs within each state, within each region, and we can all learn from each other. Our aim is to make sure that state-tribal collaboration is a positive experience for everyone, and that means making sure that we can establish those important relationships and establish good lines of communication. So we want to thank everybody for participating today. If you have any other comments, please go ahead and type those into the chat box and we will follow up with you. Thank you so much for all the presenters today and for keeping us all on track. So have a wonderful rest of the day, and we look forward to providing more information along state-tribal collaboration in the future. Thank you.
Thanks, everybody. Have a wonderful day.